Hi there, and welcome back. Welcome to Fundamentals of Remarkable Customer Service. It's my pleasure to talk to you today about a very important topic, and that is customer service. And it is such an important topic that really it's the backbone of remarkable care. So whenever you hear the words remarkable care, I hope that you not just think of it being something that is clinical, but something that is deeply about providing service to a customer. It is elevated customer service, really. So I wanted to talk to you today about some myths. Myths in customer service. About customer service in healthcare. So healthcare is an interesting place in terms of there are some sort of beliefs out there that, whether you believe them or not, they sort of float around, and I want to address them directly because these myths are the antithesis of Illume, and they are the antithesis of remarkable care. So I'm just going to talk about them for a second, bust the idea of what they are, and start to shift and give you some new ideas and thinking around what customer service is. And your patients and your families are customers. Actually, more than that, your customer is anyone you serve. So I feel like you are my customer. And if I work in the office and I'm the scheduler, then families that I interact with and build a schedule, they're my customer. And the people in the field for whom the schedule will be followed, they are my customer. And if I am a supervisor, then certainly the patient and the family are my customer, but also my team, my care team is the customer. And also my supervisor, the director or the supervisor of clinical services, they're my customer. I'm there to support and serve them. So it's very important if you're the person who runs payroll, you're the billing person, we all have lots of customers. And at all times in the day when we're working, we are delivering care to somebody. And so these concepts that we're going to talk about today apply to all aspects of customer. And really, in many ways, they apply to all relationships. Okay? There's nothing in here that if you use it in your relationships, it won't allow your relationships to improve. So really allow yourself to see this as a way to shift the way you interact with people. Maybe you're doing this already, and great. If you're not, I invite you to a new mindset. So there's some myths. Number one, clinical excellence is the same as customer service. I gotta tell you, this one is out there. I've seen it operate a million times where I meet somebody in the field and they might be clinically superb. They might have excellent documentation. Their technique might be perfect. They are excellent from a clinical perspective. That does not mean they are necessarily good at customer service. So I see this happen where people do their job and do their notes, but if you are not focused on the customer, and the customer is more than just the patient, it's the family, it's your team, it's your supervisor, your entire team must feel as though you need to think about everybody as a customer. And sometimes I notice that in healthcare, clinical excellence is mistaken for customer service. And patient-centeredness can be about what the patient needs in terms of their physical needs, but sometimes we interpret that as being as far as we'll go. And here I really want to bust everybody's thinking beyond that. We need to think about ourselves as a customer service organization. All of us plays the role of customer service. And when I think about industries that really exemplify great customer service, whether they be perhaps going to good restaurants where the service is well known, or going to have experience with like a Zappos online, known for their customer service, or Starbucks, their that customer experience. We need, or I would often say that a spa. I like for us to look to the spa industry and the hotel industry for ideas about how to think about people's comfort, how to create an environment and to interact with people in a way that is honoring of who they are. So we're going to bust that myth. Number 2, healthcare should be delivered in a stoic, non-emotional way to avoid inappropriate boundaries. This one I see as well, and it's just, we got to break it. It's not accurate. You can be friendly, you can be warm, you can be connected and caring, and still maintain your professional boundaries, right? You could go to a spa, right, and have absolutely impeccable customer service, and nowhere along the line in your massage, before, during, or after, are the lines blurred. So customer service and boundaries are not in conflict. You can care about someone and have boundaries. As a matter of fact, good boundaries create good relationships. So it doesn't have to be delivered in a stoic, non-emotional way. As a matter of fact, it shouldn't be. You're dealing with humans, you're in people's homes, and it's important that you connect with them. And remarkable care really is about having a connection. So number 3, the customer is whomever pays for the service. I've seen this one. Well, this patient isn't paying for it. They're just using the system. They're getting paid for by Medicaid or Medicare, or their insurance is paying for it. And so therefore, somehow in the eyes of healthcare, it's not quite the same because they're not paying for it. And that's just not how we should be looking at this. That's not how we look at it as a company. Patients are customers, and that's the end of the story. Number 4 is patients aren't really customers, which is kind of, comes from number 3. So the number 5 is the regulations don't leave for room for customer service. No, again, you can have rules, you can have boundaries, you can have systems set up to be compliant, right? And you can still deliver great customer service, right? And it's about learning how to communicate to people in a way they can hear. And there are things that a family may ask you to do that may be inappropriate. And then there is a way to artfully and tactfully state what the expectation can be. And sometimes it means you need to enroll support from a mentor or a partner or a member of your care team to help you. Usually it would be a mentor or a supervisor. But there's plenty of room for really good quality customer service within the regulations. Next one here is, I'm a clinician. Customer service is not my job. Well, it is your job. I'm here to tell you, if you want a job here at Illume, and I hope you do, because we really, really, really value great people, I hope you see that your job is customer service and that your patients really are customers. So our job is to do everything in our power to bring people the very best service that we possibly can. And so we're going to talk about our 5 areas of remarkable customer service. They're foundations. And so I want to talk to you about this because they really are set the stage and sort of pose a backbone for what more elevated, heart-connected customer service, which is remarkable care. Okay, and so I'm going to talk about these because I think it's important we talk about customer service so people actually know what it is. So we're going to talk about all 4 of these. So here we go. Before we do this, I wanted to show you this fantastic clip.